So is now the time to tell you that you're getting a little curmudgeon in your old age?
This would be a good time.
Okay, maybe we'll take that off air. Welcome to Before the Buzzer Conversations, real talk about death, legacy, and what matters most.
I'm Keith, a retired physician.
And I'm Michelle, his daughter, a broadcasting professor.
I'm not dying yet.
Thank God. But even in health, we know death will come, and we need to talk about it.
You know, it's important for parents and their adult children to have those conversations, Michelle.
But it's not always easy to talk about, and that's where we come in.
In this podcast, we'll talk together about what needs to be done before you pass and provide practical ways for you to have these conversations with people in your life.
This is not about doom and gloom. It's about living with purpose, passing on what matters most, and finding peace, even in the unknown.
So before the buzzer sounds, let's have a conversation.
All right, I don't know about you, but I spend most of my time thinking about how to do things well, like teaching my students, preparing them for their careers, raising my children well, handling my finances well, but dying well? No, Dad, that is not something occupying my daily thoughts. Welcome back to Before the Buzzer Conversations, where we're going to talk about that today, aren't we?
Yes, so even if you're not a planner like Michelle and I are, where we spend quite a bit of our time just thinking about, how do we lay out the next week for a meal or for our travel or, how we're going to best use our time. This is a topic that we're encouraging you put some thought to and create and nurture conversations that at least at some level get into this topic.
Yes, and we're not talking about make sure you have a will. That's for another episode, actually. Like thinking about how you're going to, plan for your, sale of your house and your finances and all that. We're talking about actually dying and when you are going to die, and, some people have no idea that's coming, right? It's a sudden death. But other people, and I would say maybe the majority of people, have a sense that it's coming. There's a prolonged illness or, some diagnosis that's happened. And how do you really end that well? So that's really the topic of what we're going to talk about today. So you ready to get into it?
You bet.
Okay. So this concept of dying well actually comes from a Latin phrase. Let me see if I can say this correctly. Ars moriendi.
Perfect.
Okay, good. And this has a fascinating backstory, Dad. Let's have a little history lesson and tell us about it.
Well, this is related to a couple of Latin words that came from around the 14th century in Europe when the Black Plague or the bubonic plague hit particularly Florence in the late 1300s, early 1400s, wiped out about a third of the adult population,
Wow.
as I recall. And
as you recall, because you were there.
Yeah. I read about that in the books.
Oh, right.
The History Channel. But, at the time, the population where people were dying, all the time, they would look to the two major institutions at the time, both the government, the Medici government, and the Catholic Church at the time. There were just no answers for this. And what came out of that was a series of both writings and art over the next couple of centuries that became this art of dying, really in a number of biblical principles that we've been talking about that really led to an approach to a, quote, good death, which in many ways was based on a good life. And that's what we're going to unpack in this episode.
Okay, so a good death. That does not sound like two words that should go together. So talk to me a little bit about what does that mean exactly, a good death?
Well, yes. I mean, there's the physical side of that though we may not know the hour or the day, and I'm fearful of this myself, how am I going to die? What's the process? How much pain will I be in? How will I be lucid? Will I be totally dependent on my loved ones for, toileting and feeding and those sort of things? So there is a component of that we'll talk about in a future episode about how to surround those services. But really here we're talking about living a life in such a way that there's as few as possible estrangements in our relationships, in our emotions, and the things that we should have reconciled before we get to our deathbed have been reconciled. Mm-hmm. So in many ways, it's sort of preparing for that transition well.
And interesting to think about the Black Plague time because death was so common. and so many people were sick and knew they didn't have a cure, right? So death was surrounding them, and they had to face that so often. So to have that, it's so interesting now. We've come out of a recent pandemic a few years ago, and it doesn't seem like people were really relishing the thought of dying and talking about that openly. Everyone was quarantined and scared and looking for a cure, and putting their faith in government and all these other, in medicine and all these other areas, and not really nobody, as far as I know, was really thinking, okay, well, if this is it, if this is humanity getting wiped out, how are we going to do this well? I don't think anyone had that conversation. So interesting to look back on back 500 years ago when they were forced to think about that versus now. So all that to say, our society today prolongs life. Like we put death off as long as we possibly can. And you and I have talked kind of candidly about this, Dad, but you don't necessarily think that's a good thing, even from a physician's perspective.
Correct. And, we're the beneficiaries in the 21st century of marvelous 150 years in scientific advancement. You think about the things that have happened over the course of, certainly not my life, but maybe my grandparents' life, of recognizing infectious disease, coming up with antibiotics, life-saving surgery. We've, in many ways, nearly doubled the life expectancy. It's kind of plateaued a bit, but we've seen just marvelous improvements, and we've almost become somewhat immune to the fact that there is death, because all that positive, the negative side is it's not as common as it used to be for grandma to live at home and then die in the home. And though I think we're starting to see a movement back to that, so much of death now is still in a hospital bed or in a nursing home, often alone. We saw that in the pandemic, where we were forced to have the nursing staff and an iPad sort of be those last moments. And in many ways, we've been sanitized in some way about death. So part of this dying well and living well is about making the best choices. A hospital death, there's nothing wrong with that, unless that's not what you really wanted. And if you haven't really communicated that, that's what's going to happen. And we'll talk about that some more.
Yeah, I think too, the hospital death, obviously you can't decide, in the moment, it's sometimes it just happens, right? But if you are in the hospital because the only thing you're concerned about, or the thing that it's primarily concerned about, is living as long as you can, and you have taken your medical options to the very last moment that you possibly can, is that really the best choice for the end of life? Now, this is easy for us, perfectly healthy individuals sitting here, without diagnoses, holding over our heads, and we don't even really have any family members at the moment who are facing that. But I just get to think, is that really what you want at the end?
It's a balance, right? It really is a balance. We have wonderful treatment. Let's just take cancer, for example, which as I shared in the last episode, I'm a cancer survivor. They're great options. My life 50 years ago would have been over by now because we didn't have the treatments that I got. And yet there's this concept of medical futility that is an ethical statement. I'm a lifetime member of the Christian Medical and Dental Associations, and we've worked very hard as an organization to really look at Scripture and look at ethics and try to help people understand that perhaps that third or fourth or fifth round of chemotherapy is going to be much more painful without extending life, and the benefit is gone. And we should be moving into a care and comfort mode. And having spent my career training physicians, we're problem solvers. We're designed and trained to identify a problem and then to try and solve the problem. So our natural tendency is going to be to continue to offer therapeutic options for folks. And now there is a movement with palliative care and hospice that wonderfully brings in these conversations sooner, not to take away people's choice, but have more informed choice, Michelle.
Yeah, and I can see too, though, that, this gets back to the living well concept, right? So if you're fearful of dying and that is just consuming your thoughts and you don't know what to expect and that fear of the unknown, you can see how someone could be just mesmerized by the fact of prolong, prolong, prolong. But if you have an eternal perspective, like we talked about in our last episode, if you've lived well, and you don't have a lot of these conversations that you hoped to have, or all these kind of doubts aren't, you've already worked through all that, you've lived well, then that can lead to presumably a better transition there at the end of life, so you're not kind of milking the system and your finances and everything there at the end. You're actually more comfortable with the whole concept.
Yeah, and again, we don't want to take away hope. Hope is a powerful driver for patients in their recovery. And yet hope is sometimes a very difficult line. Everybody's individual, where hope flips over into futility. Having these conversations earlier, I mean, you and I have had these conversations with Mom. We have pretty well documented in our trust and our living will about where those endpoints are for each of us, what our desire is, and having that conversation ahead of time. Now, that's not to say that things might change, but at least we've started the conversation so we have a blueprint of which we can build off of.
Right. It's like what I said in an earlier episode when you talked about the fact you got a cancer diagnosis, and when you shared that with me, it wasn't terribly frightening because at least I knew what you want. I know what you want at the end. I know what you want that to look like, and I felt like I could stand next to you and advocate for you because I was well informed. You had well informed me about that, and so again, the whole point of this, right, is to encourage these conversations and make those moments less frightening. But let's talk about first from a physician's perspective. Really, you talked about medical futility and the role of the physician in education and giving good sound advice. But what does death look like from a medical perspective? And obviously, there's lots of different types of death, but just in a general sense, I guess.
Well, you're right. There's a lot of different ways. Obviously, it's a cessation of both our cardiac and respiratory function, and shortly thereafter, the neurologic pieces fade away pretty quickly with oxygen deprivation. So there's sort of the biology around this, and again, some of us are taken home with a sudden cardiac event or a stroke or an accident where, we just have seconds or moments of consciousness that something's happened. And other people have a very, very long, protracted piece that more and more as healthcare professionals, we're trying to make those experiences more about what the patient wants, both where they want to be, whether home or in a different facility like a hospice facility or in a hospital, that's their choice, and really more around the care and comfort. But there's also things that perhaps somebody's got a terminal cancer, but there is a big major event in 6 months. Let's say that graduation from college from a granddaughter or a wedding date that, really rallying and trying to get them to that very important life event may alter the original plan from 10 years ago.
That's
so,
true.
We want to have the conversations, but we want to make sure they're in erasable ink, shall we say.
Oh, yeah, that's a great point because, of course, things can change and there can be, life events that you really want to make sure that you make but I guess the point too is not to, as the child, force my thoughts and my wishes on you, that, your wishes really need to supersede that. But I really do appreciate your physician's perspective in talking about the biology. And I think a lot of our listeners, don't have that. Have you been in the presence of someone who's died? Have you? And can you talk about that?
Yeah, and those are just such precious times. I mean, even remember in medical school, very early on in my training, being at the bedside with physician teachers and watching how they managed that process, role modeled it very empathetically with family and with the patient, even children dying of cancer, very heart-wrenching situations, and some very poignant times that I had, particularly as a young physician, sitting at the bedside in the hours and days leading up to somebody's death, and really wanting to make sure that we were doing everything we could to make that process as, if you will, comfortable, but not only physically, but were there people they needed to communicate with? Did we have to sort of bend some rules on visitation? Those sorts of things that, we want to have as few loose ends as possible.
Is there one story in particular that you could maybe share with us of someone who, in your opinion, died well?
We'll keep this de-identified. We'll call him Ralph, who was a patient of mine who had advanced cancer, lymphoma actually. This is early in my career. I was in my early 30s. I was a brand new attending physician, and we had him in the hospital with morphine to control his pain and family in. And I can remember the day that Ralph died, I was making rounds very early in the morning. So I had this precious time sitting at his bedside, shortly after the sun came up. And he was coming out of a deep sleep and recognized me. And he said to me, "Oh, Dr. Frey." I said, "Ralph, yes, it's me." He goes, "Oh, Dr. Frey, I saw him." And I said, "What did you see, Ralph?" "Jesus, I see him on the other side of the river, and he's calling me home."
What?
And I just listened, and I held his hand, and we prayed. Then he dozed back off asleep, and later that day, he passed away peacefully with his wife at his side. I had the privilege the following week to be invited to his funeral and to attend that, to share that story with his wife, and it really gave them great comfort. But I watched a strength of character and a display of this man's long-standing faith in God and Jesus that carried him to the other side. It was very precious. I'll never forget that, and have shared that over the years with young physicians.
Do you believe that really happened? Do you believe you really saw Jesus?
I do. Of course, there's a lot of discussion about end of life and near-death experiences and going to the light. And, it's hard to know for sure how much of that is just some of that biology of the brain being deprived of oxygen for a season. Some of this is hallucinatory. It certainly could be. But I think in this situation, and that wasn't the only time that I and other physicians and nurses have had these experiences over the decades, that you really have a clear sense. And again, we talked in the last episode about we're only currently aware of the world we see, touch, smell, by the five senses that God's given us, that there is much bigger things going on behind the curtain that we are occasionally the curtain's pulled back and we get a glimpse at.
So then, do you, by him sharing that, was that what makes you say he died well, or do you think it was what happened leading up to that moment?
Well, I think that was just a piece. I mean, that was a gift, I think, to him, and by extension to me as a young physician, to be reminded of the importance of the spiritual dimension. I mean, we're made up of a physical body, emotional, relational, and spiritual. And I think one of the things that we as health professionals want to always be attendant to, regardless of what people's belief systems are, that we're spiritual beings. And for those of us who have a personal relationship with God, that's a platform that helps us maybe connect even deeper and more holistically with people. But it's an area that we do need to be sensitive to. But I do think it's part of his process that his faith helped him finish well.
And what a comfort to his family, too, that you had that moment and you could share that with them. For many families, though, end-of-life decisions can be overwhelming. It sounds like Ralph, as we're calling him, and his family, they had a plan in place, and it was a very peaceful passing. But for a lot of people, that it's just overwhelming to think about that. So what are some guiding principles that you would share with Christian families in particular as they're kind of planning for those moments?
Well, there's some great tools nowadays that both your healthcare team and even just your attorney or just even the internet can help you to sort of lay out what your end-of-life desires are. And I wouldn't be the only physician or nurse that would share the always tragic situation where we think we have a plan in place, and nearly everybody agrees, but there was the estranged son who we haven't heard from in 30 years, that dad's in the ICU and he flies cross country, and disagrees with the plan, and then we get into this big kerfuffle about whose decision making is it. And again, these things happen, but the more we can rewind the tape and try and get everybody on the same page ahead of time, allows us to happen the way the individual wanted it to have happen. So some advanced planning is just really critical, Michelle.
Yeah. So then that goes into the whole living well concept. So if you're going to die well, you got to live well.
Yes.
And so that estranged son, the recommendation would be have that conversation when you're well. Don't wait until you're in the ICU.
Yeah.
But that's hard. How do you, from your perspective, in your 70s now, how, if you had an estrangement, how would you go about having that? Or, you don't have that issue. So it's how would you recommend someone do that?
Well, I think that whole concept that we're talking about from the Middle Ages about living well, a lot of it was about thinking in terms as individuals and the social unit we're in, a family or whatever that looks like. If we've lived a generous life and a humble life and a generous life, and we have relationships that are not perfect but healthy, and that as we transitioned into our death process, it's more probable that that community, however we define it, will be there to journey with us. But if there are some intended or unintended estrangements that are there that could have been reconciled, that's sad because, once obviously when the buzzer goes, the person who dies, but, those are some regrets that, counselors have to deal with years to come.
And so what we're saying is if you, as the, person who's going to die, you haven't repaired that and you haven't taken the steps to set yourself up for dying well, that burden is going to fall on your family. Yeah. And you're really leaving behind a mess. And, people should be celebrating your life and, talking about not dealing with estate and drama and all this nonsense that, really, really should have been resolved.
Yeah. And a little bit of a teaser for a future podcast. We're going to get into some specifics, some real wisdom from a career hospice doctor about what he saw and has written about in an award-winning book. We'll come into that where we give some more tools, both as the, and again, some of our audience here are the parent or the ones that are aging out. And a lot of this is going to be the generation of their children or grandchildren. So we'll talk about some ways that this can be done. It's never going to be perfect, but making an attempt is important.
Yes. So, we talked a lot about how, you're getting older and you have to make all these hard decisions and you have to think about these things and you have to, make these phone calls maybe. Let's flip the narrative. What are some blessings of aging?
Oh, gosh. Yeah. What are some of the... Well, you tend not to keep making the same mistakes, right? You're sort of realizing, and I think one of the things I've learned, and those people that are around me that I find a joy to be with. I was sharing with you that last week we had my wife Melanie and I had lunch with just some of our favorite people, spiritual mentors in us. They're 20 years older than us. They're in an assisted living environment, and their just countenance is so sweet. It's that sense of short accounts. Focus. They're longing for heaven, but they're being used. Their time and the relationships and the wisdom that they're sharing gives them day-to-day purpose, but they realize, the clock is ticking down. So I think it's that sort of sense of, not of doom and gloom that tomorrow could be the day, but how do I even more use today to the fullest opportunity? And I think the other thing that I'm increasingly aware of, maybe now that I'm retired and I have some margin back in my life, is those God moments, those sort of almost, it looks like an accidental intersection with somebody who I even haven't seen for a long time or I've never met. And I don't think those are accidental. Seeing those God opportunities to share something. So I think aging gives you that opportunity to sort of put things in perspective.
Right. Yeah. Yeah. To keep it in a good perspective. So what, aging, we didn't really get into aging as much, like for my generation, aging is, some vanity and stuff. But someone who's fearing aging, fearing that kind of sunsetting fourth quarter, does scripture give us hope for that?
Oh, yeah, absolutely. We have a lot of wisdom from the Psalms and the Proverbs from that, and again, we've been talking thematically through this podcast that a big part of it is legacy and mentoring and sharing wisdom. You have to be careful, right? And we get, we can be a little crusty. We start to get settled into our opinions politically or culturally, or
we all have that one in
we
our family.
all have that. And yet, being maybe a little more gracious and a little less likely to sort of be a little too crusty. I think that's really an important piece that, we have the opportunity to be.
Yes. Okay. So is now the time to tell you that you're getting a little curmudgeon in your old age?
This would be a good time.
Okay, maybe we'll take that off air. Okay, well, this was a great conversation today, Dad, about the concept of dying well. Ars moriendi, that Latin term, it gives us so much to think about.
It really does. I mean, that's so many lessons from history that sometimes get lost. I talked about this book. I'll just give our listeners the name of the book. It's The Lost Art of Dying, Reviving Forgotten Wisdom by Dr. Doug Dow. It came out in 2020, and she's a Christian physician ethicist at Columbia University, at least at the time of that writing. Great reference if you're interested in this topic in more depth.
Mm-hmm. Yeah, we're going to link to that book in the show notes, so you can hop on over to Amazon and get a copy if you'd like.
Yeah, that book will be a good resource if you're interested in going a little deeper on the historical piece that we're talking about in this episode. But you can think about that while you prepare for next week's podcast, which will be about preparing and sharing your legacy, what to pass on and when.
Can we talk about when you showed me what was in the safe?
Yes. Ooh, that was quite a moment.
Oh, yeah, there may have been some tears. Anyway, thank you so much for listening to us today. We ask this every time, but I want to ask it again. Is there someone on your mind when you listen to this podcast? Maybe you are listening to me talk to my dad, and you're like, I wish I could talk to my dad or my mother-in-law about this. Why don't you let us help you with that conversation and send them a link to our podcast. Tell them to listen, and then make a date for coffee to talk about what's been said before the buzzer.